On this part, Nigeria continues to demonstrate commitment to addressing population growth and human capital development.
That family planning is important for the management of our population. That family planning remains one of the most cost-effective ways to prevent maternal, infant, and child mortality.
The overarching goal of the revised policy is to enhance the standard of living of all Nigerians by fostering economic development and institutional measures to address the fast-growing population.
A healthy, skilled, and educated population growth is certain to attract vibrant human capital development. For our country to experience economic growth, human capital must be heavily invested in, particularly in the fields of health, both physical and mental, science, innovation and technology, management, education skills, and other fields.
I have also learned that the dialogue will serve as an opportunity for policymakers, implementers, and thought leaders to work in synergy to amplify issues around the new national population policy with a view of triggering collective ownership.
The population policies are usually legislative measures and programs that are designed to alter the population trend. And so it's meant for the survival and improving the standard of living of the population.
Mr. President stated very clearly that there is high fertility rate. He talked about using expanded program to involve contraceptive and child spacing.
Before 1994, population was seen as numbers, but was not linked to any other thing until the conference was held in Cairo in 1994, when population was linked to development. And a lot of emerging issues came out after the conference in Cairo. And we needed to move from Cairo to Nairobi. And that shaped the population policy we have today.
What? Fertility control. That's the number one thing. All right? Now, the second thing that has to come is investing massively in appropriate, accessible, qualitative healthcare.
So I think having more young people involved, having the private sector involved, and putting their money where their mouth is would really help out in terms of trying to see how we can push things forward and hopefully grow Nigeria's demographic dividend, which will be much higher than obviously our mortality rates and our current fertility rates.
So for me, the critical challenges for achieving demographic dividend, one is the small number of the active population. People that are working are too small. The dependency ratio is too high, 86%, it was stated in the morning. And so for us to achieve this demographic dividend, we need to change that number, build that number to a reasonable level.
So we need to look at what can we do differently? What can we do differently to improve on the funding for family planning if we are to achieve the population in our policy that we have just launched and that we have committed ourselves to. Just after the commitment, we saw what happened in the budget. You cannot do any program without money. Money is key, and if you are going to do family planning effectively, knowing that out there in our nation, 20% of women are there asking for family planning, they cannot get it.
If we have, so civil societies can do more community engagement at that level, creating awareness and sensitization so that the people start demanding for this funding, healthcare, and family planning as well. If we engage the traditional rulers, the youth groups, the women groups, and the men groups, especially the men groups, in this, we will achieve more.
We need to have intra-sectoral reprioritization of the family planning funding. And of course, as Mr. Esiche mentioned earlier on, and I believe he's not the only private sector person that we're engaging, there has to be strategic engagement of the private sector in bridging the funding gap for family planning. And of course, we also need to engage with catalytic family planning investment by donors.
Both NIPS and ANI have contributed in addressing developmental challenges by engaging in research advocacy and sensitization activities to provide solutions and promote attitude change, accountability, and good governance at all levels of the society. In particular, Senior Executive Course Set 42 of NIPS focused on population growth and human capital development, challenges and opportunities. In order to deepen this process, there is the need for a policy framework for the implementation of the research findings and recommendations from NIPS.
I would also like to thank the Development Research and Project Center, DRPC, as well as Bill and Melinda Gates Foundation for their support